Hello, everybody. Good afternoon. All right, if everybody can find their seats, we are going to get this party started. Hello, everybody. Thank you for being here on this Friday before Thanksgiving. My name is John Christensen. I'm the board president of the Orange County Forum, and I take great pleasure in welcoming you to a sold-out 25th anniversary of the Orange County Community Indicators Report rollout. Yeah, give yourself a hand. You know, today we have an insightful program that features an engaging discussion with community leaders who will analyze and explain the key findings of this year's report. The annual report, created through the collaboration of the Orange County Business Council, First Five Orange County, the Orange County Community Foundation, CalOptima Health, and Orange County United Way, serves as a guide for shaping Orange County's future. We're excited to announce and then explore all of the trends, challenges, and opportunities that define our community today. Now, before we get started, let's recognize some of the incredible partners who have made today's event possible. We're going to start off with a huge thank you to our title sponsors for the fourth consecutive year, right down here, UCI and UCI Health. We would also like to thank today's promotional sponsor, Venture Strategic, for their essential support at today's event. And let us please acknowledge all of our ongoing Orange County Forum sponsors. It is your generous support that allows us to host great programs like today. You know, we're very blessed to have a group of talented and dedicated people on our Orange County Forum Board of Directors. They generously give their time and their talent to organization and to events like this. So always in their favorite thing to do at these luncheons, would my fellow board members please stand and be recognized? All right. You know, I'd also like to recognize all of the elected officials and their representatives that have taken time out of their busy schedules to be with us today. So at this time, would you please stand and be recognized? Thank you, Mayor. Hello. And lastly, I want to give a heartfelt thank you to all of you, because without you, we wouldn't have a great day like today. So thank you for being with us. That's what makes our events so special. You know, as you look at the color of my hair, you'll know that I've done this a few times. And I'll tell you, I'm always happy to introduce this young man. He's a renowned economic strategist and the chief economic advisor at the Orange County Business Council. With more than 25 years of experience, he's led innovative programs in workforce development and infrastructure through roles with organizations like the Southern California Association of Governments and the Draper Hero Institute. He's also the founding president of the Center for a New California, where he focuses on the impacts of automation and AI on our economy. He's a frequent contributor to publications like The Economist and The Wall Street Journal, and a key voice on California's economic future. Please join me in welcoming my friend, Dr. Wallace Walrod.
Thank you so much, John, for that very kind introduction, and it's so great to be here amongst many, many, many friends. Well, as John said, it's the 25th anniversary edition of the Community Indicators. I'm very excited because we are looking back 25 years and talking about what's going on today, but looking forward 25 years. The report was started in 1999, and it very broadly covers what's going on in Orange County. You know, from the economy to education to the environment, everything that we can think of that's important for you to know is what we cover in the report. The other thing I wanted to acknowledge is it's great that I think we have at least 3 of the original team in the room here. This started under the leadership of Mike Ruane. And then Lisa Burke is here. And then I think Kathleen Freed is here as well. So maybe we could give a round of applause to them, because Those three people and I sat at a table, and a couple of other people who couldn't be here today, and kind of dreamed up this report. So we usually cover some of the same things that we report the progress or where we need to do work on. So those are, we do the Orange County profile, which compares Orange County to other peer regions. We cover, as I said, the economy, housing, income, education, infrastructure, health, and the environment. But this year, what I'm going to focus on mostly is the 25th anniversary. We always do a special feature every year. And this year, it was too obvious to just cover the 25th. So we're going to look back 25 years and see what's changed and what's stayed the same. And while the last 25 years have seen a lot of change, some of the same challenges are here that you'll see become very apparent. And some of the strengths remain from the end of the 20th century. So let's go back to 1999. Keep some of these numbers in mind as you go through the rest of the slides. So we had about 2.8 million people in Orange County in 1999. The median household income, which was high for the region then, was just under $60,000. The median home price was $275,000. We'll talk a lot about housing today. Our largest industry actually was durable goods manufacturing. It was bigger than every other industry. And if you combine durable goods manufacturing with non-durable goods, that was about 215,000 jobs. So manufacturing has come down to about 155,000, while the other sectors have sort of grown. And probably a lot of people in this room don't remember, but the biggest concern in 1999 was Y2K. I don't have time to explain the obsession with Y2K and how much the fear that was out there, but you can Google it or talk to somebody who's older, and they can tell you all about Y2K. That was supposed to throw the country and the world into chaos. So since then, by 2024, we've grown to about 3.15 million people. So we've grown about 13.2%. You can see that's more than LA, but some of our surrounding counties actually have grown quicker than us. And just to give you a little context, the state has grown population about 18%, so we've trailed the state, and the nation has grown about 20%. So we have trailed the state and nation. And then here's by age group, and you'll see several slides on this particular topic. So the orange bars are 2000, and then the latest, we used that instead of 1999 because of the census, so that was the census year. And then we didn't have the 2023 numbers yet when we put together the report, but I'll have some updates on that later. But even during the last 20 or 25 years, we have already started to see some of these demographic shifts that are going to accelerate. So you can see the younger parts of our population declined as a percent of the population, and then the older parts of our population have increased. Also, we became much more diverse. Our white population was about 51%. In the last year that we had data for, it was about 37%. Our Hispanic or Latino population increased up to about 34%. And then our Asian population actually had the greatest percentage increase during that time period, up to about 22%. And you'll see this later, but interesting note is that approximately 30% of Orange County residents are foreign-born right now. So I think that's a higher number than a lot of people would probably say. You know, education has always been a real bright spot for Orange County, and two ways we measure that is the UC or CSU eligibility rate. That's a good measure of college prep, and that has grown to 57%. That's an amazing number. That's very far ahead of any of our surrounding counties. And then the bachelor's degree or above has really increased. We have the most educated workforce in Southern California, so up to 41%. I actually have a little bit of an update on that as well. In terms of our labor market, the orange line here is our unemployment rate. Other than during the a little bit in the dot-com bubble there. You can see a little bit of a rise. Then, of course, the great financial crisis, that actually hit Orange County very hard. We had a lot of mortgage lenders, subprime mortgage lenders here, so that hit us especially hard. And then, of course, COVID hit, and that had a short spike up. But other than that, and once those peaks happen, we work our way down. We really have been between 3% and 4% unemployment, other than those recessionary periods, for most of the last 25 years. Other counties would be envious of us basically our steady state is between 3% and 4%. Another thing I thought that really tells the story about how Orange County's economy has changed is if you look at venture capital in 1998, we're able to go back one more year, and then in 2023, you can see on the left that in 1998 and 99, cell phones were becoming a big thing, and Orange County played its role in that. A lot of people forget we still do have manufacturing, as I said, and that was a big part of the story, but you can see what has changed in terms of where investors are putting money in Orange County, early stage companies, so transportation and climate-related kind of startups. And then here's where, sorry there's so many lines, there's so many comparisons to make, but the orange line you can see is now the third highest. Those other two lines above us are San Francisco and Santa Clara County, the Bay Area and Silicon Valley. And remember that $275,000 number? It's $1.45 million now is the median price. And people ask me, what surprises you in the report? This one probably is the biggest surprise to me, that we far exceeded most other counties, including Santa Clara County, the heart of Silicon Valley, in terms of percentage increase in home sales prices. We by far beat San Francisco, California, Los Angeles, and that's a testament to the fact that it is a very attractive place to live and work. We just have more demand for housing over the last 25 years than we've created supply. So that was a quick look back. Fast forward now to 2024. Here are the biggest kind of key changes overall in the report. So we actually lost population in 2020, 2021, and 2022. A lot of counties did because of COVID. People moved to more rural places, less urbanized places. But we did reverse that in 2023. So we did gain, we were about 10,000 gain after losing about 40,000. We had gotten close to 3.2 million. We added about 24,000 jobs, but our unemployment rate increased. That's kind of a strange thing to think adding jobs and increasing unemployment. It means that more people are coming back into the labor force that had departed because of COVID. And then if a country, our gross regional product is well over $300 billion now, and it increased very nicely, 3.5%. If Orange County was a country, maybe someday, I don't know, we would be just behind Chile and the Czech Republic and just ahead of Finland and Portugal. So that's pretty amazing to say we would be more gross product than Finland and Portugal. Here's sort of comparison with our neighbors. You can see that we have the highest median income, and actually have another slide just after this one that updates this. We're the oldest demographically. You saw those shifts occurring. We have the lowest poverty level. We're doing actually pretty good on commute times. OCTA is doing a great job with their investments. And then, as I said, we have one of the highest foreign-born populations in the state. This is the only slide of material that's not in the report. I'm actually doing the Southern California Economic Summit up in downtown LA on December 5th, so we processed some new data. We're down at 4% unemployment. You can see remember it was 41.5, I think. Our actually bachelor's and above educational attainment is now 44.5. So we continue to get more and more educated. We only trail a couple of the Bay Area counties in California on that, and we're much more educated population. Remember, it was about 106,000, the income. That's actually gone up to 113,000. And then you can see we actually improved on the poverty rate as well. Housing affordability is our Achilles heel and continues to be. It was even when we're at 275,000. California Association of Realtors talks about by county what is an entry-level home price. An entry-level home in Orange County is now $1.16 million. That went up 14% in the last year. And the minimum qualifying income actually went up more, 21.3%. You might ask why, because incomes rose. It's because of mortgage rates. The rise in mortgage rates created that. We are the second least affordable county for first-time buyers. Maybe not a lot of you know where Mono County is, but it's a county of 14,000 people. So it's a little bit of a strange situation. Their median price is $710,000, so less than half of ours. But because their incomes are less, they are unaffordable. And you can see some numbers there regarding this is not just an issue for owning a house, but it's an issue for renting. Orange County is a very expensive place to rent as well. And because of all these things, our home ownership rate has gone down over the last few years. What's the cause? We simply haven't built enough new housing units. Now, we have a lot of projects in the pipeline that are hopefully going to be a big part of that solution, but still, we need to just plan for, approve, and build more housing units. In terms of our graduation rate, we had made progress last year in terms of the gap between socioeconomically disadvantaged and non-socioeconomically disadvantaged. That did tick up a little bit, unfortunately. And in terms of English language arts, they've been mostly stable, but this has been in a little bit of decline. And I think the cause of it has been the impact of COVID over those couple of years and remote learning. The only one that actually increased in the last year was our Pacific Islander. And you can see our Asian and Filipino populations actually have the highest English language arts ratings. Mathematics is a different story. We're actually doing pretty well there. Obviously, that's important for the STEM fields that we know are going to be a big part of our future. And you can also see that our Asian and Filipino communities have the highest attainment there. This has been stubbornly the gap between different ethnicities in Orange County in terms of that UC-CSU, the college prep. And this is kind of an interesting story. When I started doing this, our Latino percent that was UC and CSU eligible was below 20. That's actually 43%, so that's grown by over 100%. It's just that our highest group, our Asian students, is almost 82%. So that's what keeps that gap. Both are increasing, but our Asian students are just performing so well that that gap has been stubbornly large. Interestingly enough, and the last data that we had was 2022, in terms of uninsured, it actually went down for all three groups below 75,000, but it went up for those above 75,000. So that's really interesting, and I'm sure our panel is going to discuss that later. Just a little bit, our prevalence of these chronic diseases increased, but death rates declined, except for diabetes. So our healthcare system is performing well. Fortunately, two things that had been a real issue we're starting to see some progress on mental health and depression and opioid-related deaths. Still, if you look back 10 years, the opioid death rate and the visitation rate and hospitalization rate has just gone up by quite a bit. So now we're going to look into the future. And since we've looked at the past and present, some of it will remain, but some of it is definitely going to change. This chart, Orange County is only projected to grow by about 3% in the next 25 years. That's far behind Riverside, San Bernardino, and San Diego. But you can see actually Ventura and Los Angeles are projected to lose population. And so there is something to our coastal regions are starting to become unaffordable, and people are starting to move to more inland locations in California and out of state. And this, of course, the culprit is that housing situation, and we'll have a slide on that in a little bit, and of course has talent pipeline implications. And as Lucy Dunn says, housing is where jobs go to sleep at night. We need to really factor this into our thinking about we really need more workforce housing. And then, so looking out 25 years, those same trends of getting older and losing our younger population just exacerbate. It is kind of a little bit of a doom loop that we see. So by 2049, we're going to have a major increase in our 65 plus, making up much more than we're going to increase. And then what that means is by 2049, we are only going to have in 0 to 5 less than 5%, 6 to 17 about 10%, 18 to 24 about 8%. But then you see the growth in 65 plus. And then we actually took it out a little bit farther to 2060. These are all State Department of Finance numbers that are based upon the updated census from 2020. So they have kind of changed their projections quite a bit. That actually goes up to 31%, and you can see the other 0 to 5, 18 to 24, and 6 to 17. The biggest drop is actually in 6 to 17. That falls from 15 to 10%. So that has major implications for our school districts, our K through 12 school. And then another big change from the State Department of Finance projections. As I said, we were about 39% white now, about almost 31% Hispanic or Latino, about 23.5% our Asian population. Our white population declines to about 35% by 2060. Our Latino or Hispanic population declines a couple percentage points, and it's our Asian population and mixed race that are really going to be increasing. And in fact, the Department of Finance numbers show that our Latino population actually peaked in 2020 and has declined since then. And actually, our Asian population is projected to surpass our Latino population in 2051. So that's a big change from their prior projections. I did look at surrounding counties, and LA, Ventura, and San Diego also have kind of the same projections, whereas the Inland Empire counties, Riverside and San Bernardino, don't have the same projections. So it is a coastal phenomenon. Housing unit change, you can see here that we're only projected to build 8.3% units. That's less than Los Angeles, folks. Even though Los Angeles is going to be declining in population during that time period, we've got to do a better job of this. We've got to make sure that these numbers are not correct. But these are based on very good data. So we really need to do a much better job of building housing units. Primarily over the last 25 years, a lot of the housing unit production has been in Irvine. That is going to spread throughout the county. And as you can see, Anaheim is going to grow by almost 100% more in terms of housing units. And actually, Costa Mesa and Fullerton are going to have more housing units. And as a percentage of their current housing stock, Fountain Valley, Costa Mesa, and Buena Park are going to have the most increase in terms of new housing units. Employment in Orange County is going to grow by about 18%. I think the limiter on that is our housing. So basically what this means is we're going to continue to grow. We would have a much higher growth rate if we were able to provide the housing necessary, but we're also going to have a lot of people commuting into Orange County, obviously causing traffic and all that from all our surrounding counties. We are a net importer of workers now from every surrounding county, including LA. Finally, as John said, I've done some work on AI and automation. We decided it's way easier from the data we have today to project out 25 years what's going to happen with occupations rather than industries. And you can see healthcare as you get older. Healthcare related jobs are going to be the big job grower. And then you can start to see in the ones that are the bottom 5, the impact of automation on those. So office and administrative support, and sales are related. Those are things that automation is going to probably reduce some jobs. Then we take a deep dive. I won't go into these too much, but here are the ones that are going to be growing quite a bit, and you can see our aging population also translates into particular occupational categories. I think about half or more of these are actually healthcare related. But you also see tourism and tech there. And then similarly, the declining ones are ones that automation is going to have a major impact on. So a lot of sort of trends that are going great, some trends, specifically the impacts of not providing enough workforce housing that are going the wrong way. And so my job is done now. And I get to hand it over to, it's my pleasure to introduce the main man, top dog, head honcho and big kahuna, and the man, the myth, and the legend, OCBC's president and CEO, Jeff Ball. And you can see the report sponsors here. Thanks, everybody.
All righty. Check. Not like I need a mic anyway. So wonderful to see such a full room. Who says we can't get people together in Orange County the Friday before a big holiday week, huh? No, because here we're very, very focused. I wanted to thank a few folks before we get into the panel. We're going to have them come up, but I want to thank our great partners that work with us every year on this report: CalOptima, First Five, United Way. Who am I missing? Orange County Community Foundation. So thank you, Shelley. I don't know if Shelley's here, but thank you all for being part of it. I also want to thank our corporate sponsors that have been very engaged in this process. Our title sponsor, Experian, as well as Cathay Bank, Kaiser Permanente, and Southwest Airlines. All great partners, and we really appreciate their support as well. So without further ado, let's get this rolling, and I would like to call up our panel, and if the three of you can just come on up, please, and join me on stage. On our panel today, we have John Gould, who is the Dean of the School of Social Ecology at UC Irvine. We have, yes, give it up for John. Elizabeth Andrade, who's the Executive Director of 2110C, which I hope you all of you are aware is now part of our Orange County United Way. And yes, and I'm also joined by Veronica Carpenter, who's the Chief Administrative Officer with CalOptima. So wonderful to have all of you. And I think, to get started with this in our discussion today, boy, thank God we got through Y2K. The largest concern back in 1999. But I'd be interested in what each of you think is our largest concern now in 2024. And we're going to write these down so that we can mention them 25 years from now. Liz, do you want to start?
Happy to. So in Y2K season, I was concerned about water. I just have this vivid memory of me being concerned that we would have no water for many, many days. And so I'm glad that that didn't happen. I think my biggest concern, not only for myself and having children who hopefully will stay in Orange County, is the housing, and how do we ensure we keep our talent and our children and our families together.
Thank you so much.
I think it has to warm up. Go ahead.
There we go. What a great question. In 1999, I think I was hiding under my bed because I was one of those who thought that the world was going to end at Y2K. So hopefully that doesn't happen again in 25 years. From a healthcare perspective, from a CalOptima Health perspective, we insure 913,000 people in this county. And I think that is a fact that most people don't realize is the vast majority of our population, nearly 1 in 3 residents. Nearly half our kids are Medi-Cal members at CalOptima Health. So as we look ahead to aging populations, how are we going to sustain a workforce? How are we going to make sure that the little ones who are in school right now are getting all the services, the mental health, the well-being checks, the wellness checks, all of the above? What are we going to do to sustain that? So I think that would be a biggest concern from a healthcare perspective.
Okay, John?
So I have only been dean here at UCI for 3 years. But the answer to the biggest problem and the biggest takeaway from all of this has been the same thing every single event I go to. It's housing, housing, housing. And I'm going to give you one statistic that wasn't presented today that kind of brings this home. We operate a poll out of my school at the School of Social Ecology. We're trying to look at big ticket problems, issues in the county, and we did a poll on affordable housing and homelessness last year. We asked renters and we asked homeowners if they had been concerned in the last couple of years about whether they'd be able to make rent or whether they'd be able to pay their mortgage. 50%, half of renters were worried about being evicted or had been worried about being evicted in that time. Half. 20%, 1 out of every 5 homeowners, had been worried about being foreclosed upon. So it's not simply that we are not building enough housing, we don't have enough housing. It is that the housing we have right now is potentially becoming out of reach for a number of people who live here in the county. That is a time bomb. So sorry to start on a downer, but...
No, that's, I set it up. I asked what you were most worried about, right? So another statistic that Wallace gave, which was referenced in the comments, was about the change in the population and the shift. And, you know, I look up on stage here, we don't seem to be getting older, but I look out in the crowd and like, oh my God, maybe the charts are right. But talk to us a little bit, Liz, about with the work that you do and what the impact of this projected population shift means for the services you provide.
Of course. Who, by a show of hands, who is familiar with 211? Who's heard about 211, used 211, referred to 211? Fantastic. Awesome. Thank you. So to start off, 211 in its essence is a 3-digit dialing code. It exists up and down the state and across the nation, and it exists to ensure that people get connected to the social and health services that are available in their region to help resolve their current situation. And so as we look at our current reality and the projections that are reflected in the data, we see and receive the calls from the aging population. The seniors who are looking for rental assistance because they're on fixed income, the seniors who are needing utility assistance during the winter months because, again, that fixed income prohibits a lot of those adoptions of the additional costs during the winter. And so what we have done and how we're resolving some of the additional needs is with a partnership with the county through the ADRC, the Aging and Disabilities Center, Resource Center, and thinking about the infrastructure that is 211 and the ability to ensure that whatever resource is available gets connected into this front door, centralized and trusted resource that has an easy to remember dialing code is essential. And so I think as we look ahead, the programs that are developed to either upskill and move aging populations further into the workforce, or whether there are resources that help promote to stabilize our aging population, running them through and ensuring that there is connectivity so that we're making sure that our aging population has a one-stop trusted point of entry.
Veronica, talk to us from perspective of CalOptima and health insurance. And we saw that interesting data point that Wallace talked about, that our residents over 75,000 in income is actually a category that's increasing in terms of uninsured. So as we think about that with the demographics of an aging population, what does that mean from a public health perspective?
Sure, thank you for that. So older adults, we know, is the rising population, right? We've known that for a long time. And it's how do we get those folks who have an unexpected death in their family, maybe a spouse has died, and then they can't afford to make their rental payments, they can't afford their mortgage payments, people who are on the brink of homelessness or becoming unhoused. How can we help those folks stay in their housing? How can we ensure that they're getting to the doctors? We recently rolled out a cancer prevention campaign to try and get older adults into cancer screening programs because they are so low. How can we work to preventative care? We have a program at Cal Optima Health called the Program for it's All-Inclusive Care for the Elderly, our PACE program. We are busting at the seams, quite frankly, because we have so many enrollees trying to find care all in one stop. So we're looking to expand. How can we create housing to where we can also have a PACE program and be innovative, and so our older adults who are aging quickly can receive services where they live, close to where they live, in their communities, in their languages. So I think that's where we would look to go in the next several years.
So, John, as we look at this shift, your group has done a lot of studying around some of these different trends and what we're hearing from residents, not just that are here, but some that have even moved out. So I'd like you to talk a little bit about that. But, you know, obviously the affordability is a big issue here. And so as we think about this population shift and having an older population, lots of things come to mind. Wallace mentioned education, but what are some other areas that you're focused on through your studies that we should all be aware of as we prepare for this continuing trend in our aging population?
Well, let's start with the good news, which is apparently I'll have a lot of company as I get older here in Orange County. One of the things we asked on one of our most recent polls is whether people had been thinking about leaving the county at any point. We hear all the time about brain drain, that people are thinking of leaving California. And what we found was exactly what Wallace said earlier, which is the county really has not seen much change in people moving in and out. However, what we did find was that 37% of residents today are thinking about leaving the county. And if we add in people who had been thinking about it over the prior 2 years, we're at more than half of county residents. Now that is a potential time bomb, again, that's looking to blow up at some point. The two issues that are driving that are cost of living and cost of housing. Now we can't do a whole lot about cost of living, but we can do something about cost of housing. There was only one group in all of that demographic group that were not worried about cost of housing, and that was people who are currently over the age of 65, because they're in their houses, they can afford it, they think they're pretty well off. You will probably not guess which group was the most pessimistic. You're all going to say young people, 18 to 40. It was 50 to 64. Because this is the group that's worried about whether they're going to be able to afford their own retirement here in Orange County. So again, it's going to go back to affordability, affordability, affordability. And we do have an opportunity to get ahead of this wave by focusing on housing, but we need to do something.
So obviously one element of this change in our population getting older is the demand for healthcare services. And we're seeing tremendous investment in healthcare services throughout the county. But what does this mean from a workforce perspective? And I know you've been doing a lot of work at Cal Optima around preparing the workforce. Talk about what you're seeing from Cal Optima's perspective as we need to address this workforce challenge.
Sure, thank you for that. So one of the things that we identified through a pilot program with Cal State Fullerton, we funded a $5 million stipend for social workers, because social workers who were going through the system at Cal State Fullerton were leaving the county because it's not affordable to stay here. So we took a look at the data, and we rolled out a program, and we realized we kind of accidentally fell into something that was so desperately needed. Our board approved a $50 million initiative to continue pushing money into workforce so that we can keep people who are healthcare providers who are going through our wonderful academic systems such as UCI, Cal State Fullerton, here in Orange County by providing them stipends, hours of training and really make them feel connected to Orange County. We were proud to roll out an initiative that included $5 million into nursing for UCI Health, and then also for Cal State Fullerton. And we have more in the pipeline of how we're going to try and address it to keep that talent here in Orange County.
Okay, so one of the big aspects of all of this is homelessness, right? When we have the housing challenge, and we know homelessness leads towards a lot of mental health challenges. Talk a little bit from United Way's perspective as we look at not just the aging of the population, but what Wallace forecasted. We're going to continue to have this shortage of housing. So what does that mean in terms of how we address homelessness and the programs that United Way has established?
Yeah, thank you. So housing, the indicators are indicating housing is an issue, and folks who can't afford their housing and can't access rental assistance and can't stabilize may be evicted. Not everyone who is evicted is unhoused, but there is clearly a correlation that runs through from the point of someone calling and needing support and asking for support to what we're seeing within the rise in homelessness within Orange County. And so I'll approach it first from the 2-in-1 lens, and then talk briefly about the strategy within United Way. And I'll preface this by saying that in July of 23, 2-in-1 was acquired by Orange County United Way, and what that provided us with was an opportunity to provide comprehensive care. So leveraging the 2-in-1 infrastructure as a triage and community engagement strategy to not only help connect folks to United Way supported and implemented programs, but also to provide information and data to help craft and adjust those programs as well. And so from the 2-in-1 perspective, more than 50% of the calls that we receive every day are related to housing. They are folks who are looking for assistance to stay housed, they have received an eviction notice, they're desperate for support, and folks who have lost their housing. Imagine standing on a corner and perhaps being given one of the 2-in-1 cards, and you're dialing, trying to figure out what to do, what emergency shelter may be available for you, how can you access housing. If you are able to connect with one of the available navigation centers and have a caseworker, how do you find housing in a rental market that's so tight? And so there's obstacle after obstacle after obstacle in someone's journey back into housing. And so that is my plug for continuing to invest in prevention and finding those elements that will predict whether someone is more likely, if the propensity is higher for someone versus another person, to become homeless if they are struggling to maintain their rent. So that is something that we are extremely interested in providing that type of information out to the community to make those decisions. Now, thinking about someone's journey from being housed, because that's people who are unhoused all have something in common, and that's that they were previously housed. And so with the work, the tremendous work under United to End Homelessness, there is a designation and a realization about getting people immediately back into housing with a network of service providers to provide that case management, because it's the identification of what type of subsidy could be available, what type of assistance, which CalOptima through CalAIM Benefits has done a tremendous job in rolling out additional benefits. So I'll just, for those who may not be familiar in the room, although I see many familiar faces and you are all real experts in this, but I'll just say 80% of the folks that are calling 2-in-1 are Medi-Cal eligible or enrolled. 53% are looking for rental assistance or looking for housing. Through CalAIM Benefits, if someone is a CalOptima member, they are eligible for additional resources to help them identify housing, help them with security deposit to get back into housing, and help with case management to help stabilize in housing. And so through partnership, there is more investment today in ensuring that we can reduce the time someone experiences homelessness. And so United to End Homelessness has been a champion not only in the advocacy for such programs, but also in the implementation with programs like Whatever It Takes to ensure that people get the resources that they need, as well as looking and securing rental units in the community.
Okay, so John, housing, right?
And education.
And education. but I want to focus first on housing. Well, I know you're going to do a good job of bringing both of them together in answer to this question. So we know that it's less and less affordable in Orange County, right, from a housing perspective. Yet our population has increased last year. The previous years it went down a little bit, but not significantly. So we're really maintaining our population even in the midst of all of these challenges around housing affordability. So is brain drain a real thing?
So it goes back a little bit to what I said before. Not right now, but it's lurking. But let's tie this back to education, because education and housing really go together here. So Wallace told us before that Orange County has a very high percentage of us who are college educated. That's one of the highest rates in America, not just in California. We are a highly, highly educated population. And my institution, the University of California, Irvine, takes great credit in what we do, and my school in particular really exemplifies something we call inclusive excellence. And this is not simply my school, but I'm giving you an example of this because it's going to be part of where I'm going with this. So our undergraduate student body is 2/3 non-white, of which half of them are Latino-Latina. Half of my undergraduates are the first in their family to go to college. Half of them as well are what we call Pell eligible. They're eligible for Pell Grants, which is another way of saying working class, working poor. They're incredibly talented, and we like to think we do a good job of educating them, and I think we do a very good job of educating them at UCI and a number of our institutions here in Orange County. We have a lot of very good institutions of higher education, and we get this large percentage of people who are college educated. So the question then is, we've helped bring them up. We are helping them achieve the American dream. Where are they going to take that American dream? If they can't afford to stay here, where are they going? And we've said that there's not, at the moment, a large outflow. But let me ask you, for those of you who want to play a quiz here, and you all get A's for whatever your answer is here. Where are people leaving when they leave Orange County right now? Where are they going? When you go talk to people at your holiday parties, where does everyone say they're all going to? Texas and Florida and Arizona. Two-thirds of people who've left Orange County tell us they have gone to, wait for it, California. They are going to eastern Los Angeles County. They are going to the Inland Empire. They are going a little bit to eastern San Diego County. We are losing people to our neighbors. These are people who've grown up here. We've spent a lot of money, folks, educating them. And we are pushing them away. Now, maybe they come back and work, but what kind of quality of life do they have if they're commuting an hour and a half each way to come work here? How much attachment are they going to have to jobs here, to life here? We are sowing the seeds for our own problems if we don't do something to help provide these people that we've given tremendous opportunity the chance to stay here and be part of our communities.
Well, and the good news is, as we see from the numbers, there are job opportunities that are being generated in Orange County and will continue to be generated, and it all comes back to that key word, housing, right? And what it is that we need to do from a policy standpoint to be able to address the housing supply so that our builders can build what it is that our market is demanding, and oftentimes government limitations that get in the way of their ability to build and to do it in an affordable way. I want to start opening it up for the audience because I know you have a lot of questions, things that you saw in the report that you might want to ask about. So we've got a microphone here that Georgie's holding. So if you have a question for the panel, we're going to go ahead and open that up. Do we have any questions now? We'll go ahead and, it's Mr. Churm. No, we need it on, and I think it's working now.
All right, here we go. Thank you, Jeff, very much. And thank you to the panel and this program. Very important, and it's just wonderful. It was said earlier to see this room wall to wall, front to back filled. That shows there's some concerned people here, so that's great. My question is for you, Liz, and it's about 211. We heard from all three panelists, all right, about the crying need in many corners of this county, not just in one area of the county, but all across the county. Housing, we've heard about that and so forth. But the question for you, Liz, is I think this is the time for 211. The next 5 years are all about connecting the county to solve these problems collectively. What does county government and the businesses in this room need to do to help you, Liz, expand awareness and the functionality of 211 to be a super-powered connection to solutions that you've all said are needed?
We all need 211. So 34 cities, one county. Imagine where the 12,000 callers each month would go without 211. So when I said earlier that 211 is community infrastructure, I do mean that. It is designed to be a community asset. And in the last year, we have developed and supported it to get to where we are today. We're at baseline. We are ready to launch. In the next 5 years, and as I see all of you here today, what I would ask is that in that journey to excellence and innovation and continuing to be a thriving 211 to help all of us, that we need to continue to build together. So what does that mean tactfully for all of you? It means advertising 211. It means using it. I had a pretty heartwarming conversation right before the start of this program where I received, when someone tells you, like, I called 211, you're like, okay, tell me more. And this just blew me away. It was the ability for our information and referral specialists, the people who answer the phone, those 12,000 calls every month, their care and their compassion, that's our secret sauce. That's what makes us unique, is that there is the live connection to someone with a desire to have the best outcome and result for that person. And when folks are struggling, if you can imagine the last time you reached out and asked someone, a stranger, for help, that takes a lot of courage. And so as we look to build, there is a lot that we're doing around technology and investments and data and dashboarding and supporting community with community information for decision making. All of that will continue to unfold over the next 5 years. But if you take one thing away from anything that I've said today, is that the results that 211 produces are because we have people who care about people within our community. And that's what ties together the 34 cities, our one county.
Okay, I think we have another question back here in the room.
Thank you. Appreciate you guys being here today. It's just really a great opportunity for everybody to get to know more about what's going on with your guys' services. Being in the real estate business and seeing communities out there, and we have such a widened gap now between our upper class and our lower class. We're at the poverty level, and people that were at middle class 10 years ago are now get to that poverty level now. And my question is the accessibility to services. Obviously there's qualifications you got to meet to get access to these services, but I don't see those numbers increasing for the lower end, going up to that where that middle class is struggling now. They don't qualify for these services because they make too much money by a few $100s or whatever it is. So what's the solution do you guys see going down that path in the future?
Who wants to you want to try it?
Sure, I'm happy to. Thank you for that. I think one of the things that we've seen since COVID, since the public health emergency ended, is what we call redetermination or revalidation that all Medi-Cal members have to go through. So for 3 years, the county was able to make eligibility decisions based on what was good for the client, so to speak. With the revalidation process that every Medi-Cal member has to go through yearly, we've seen a drop in our numbers. One strategic initiative that CalOptima Health will be seeking at the Board of Supervisors is to join Covered California. 10 years ago, maybe a little bit more, the Board of Supervisors had an ordinance that prohibited CalOptima Health from participating in Covered California, and we would target exactly that population that's just making a couple $100s, who have just fallen off Medi-Cal, who are maybe working overtime, maybe got a second job, but are still unable to pay high out-of-pocket premiums. We recently had a casework come through where one of our members was diagnosed with breast cancer, fell out of Medi-Cal, can't afford her surgeons, can't afford her oncologists, and is now without insurance and probably not getting treated. So if we could serve just one member in that capacity, I think that endeavor is definitely worth it.
John, go ahead.
So all of this is absolutely right. But I also want to add one other thing, which is when we talk about people in need, obviously we are talking about people who are really barely scraping by. But when we talk about housing, it's a different story. So if I say to you, we need to build affordable housing, who do you have in mind? Who do you have in mind? In fact, I'm not going to call on you. Just picture who you have in mind right now. When we do focus groups with people, they're usually thinking of people who may be currently homeless. When I say to you, I ask you, can your kids afford a $1.4 million house? You're all going to shake your heads no. Housing goes across a lot of income levels in this county in terms of not being able to afford it, whether it's owning or renting. And that's where I'm going to give you some credit with the OCBC, that you talk about workforce housing. So if I say workforce housing, or I say housing for your children, you have a whole different vision in mind of what we're talking about. And that becomes a whole lot easier to find much broader support to build and to have that in your neighborhoods. And so I think some of what we need to be thinking about is the language we use when we talk about housing, because we really need to build coalitions across a lot of communities and a lot of different ideologies to be able to deal with this problem.
Well, affordability is a relative term. Affordable in Orange County has a much different meaning than in Mono County, which you pointed out earlier. And so what's interesting to us is the fact that, as you mentioned, John, housing touches everything, right? Each of the things we do as an organization is impacted by housing. If you're an employer and you want to expand your workforce, you need places for them to live so that they can live relatively close. If your focus is around mental health, we know the impacts that not having a proper housing drives in terms of mental health. So all of these issues tie back to housing. So I'm going to ask each of you a difficult question. If you had the magic wand from a public policy standpoint, what is one policy that you would institute that would help us with this housing challenge that we face in Orange County? Who's willing to go first? I'll tell you mine.
Yours is going to be CEQA.
Mine is CEQA, yeah, absolutely. But what would you have? From a policy standpoint, what would you ask them to do?
So with great value to it was just shared around the relative term of affordability. I think that there is something to be said about subsidized housing and periods of time that housing is subsidized. We need the inventory, and so CEQA is clearly one of the answers on policy for that. But there's also the trajectory of housing and the development of housing across all stages. And so I think from my perspective, there is the informed policy that's being driven by the local needs across all of the different criterias, and the subsidies that can be made available to help to support across all of the different components.
Veronica?
Sure. So a policy that the state of California is actually seeking to change, and I think this gets to your point a little bit, currently with the Center for Medicaid and Medicare Services, CMS, a federal waiver is being sought to allow Medi-Cal health plans to help pay for rent for members who are on the brink of becoming unhoused. So not when they're unhoused, but how can we keep our members in housing, because housing is truly health, right? No one's going to get wellness checks if they're on the street. Nobody is going to get better if they're sick on the street. And my boss isn't here, so I get to say this, but that's one of the policies that we're truly concerned that the new administration may not be able to push through CMS, because it is a Democratic. Governor Newsom feels very strongly about this, and that's one that we really hope to see, because we could help a lot of individuals. Liz mentioned it earlier. Governor Newsom implemented California Advancing and Innovating Medi-Cal in 2022. Through that, CalOptima Health has been able to push out $130 million to help fund 1,100 units for our members, permanent supportive housing and affordable housing. That's huge. So to see programs like that, which would grow under this new waiver, and then potentially be taken away if our waiver has to be renewed in the next 4 years, that's concerning for us. So that would be my magic wand, is to make permanent CalAIM and then also add the benefit of rental assistance.
Well, the nice thing about going last is I get to say, well, what you all said. But I will add one more thing that my colleagues who study this would say. And it's kind of the bitter pill, which is that we need to get used to smaller houses, and that we have to get used to more dense housing. And I will say that the regents for the University of California have started to enforce this. So the new housing that you may see going up on UCI's campus right now, which will be for faculty, is going to be smaller and much more dense. And this is one of the ways that we are going to be able to house more of our employees. And I think it's going to have to be part of the mix for the future of California if we are going to be able to build on the land that we still have available here.
So what do you think is the county in California that has the highest population density? Anybody guess? Most people per square mile, what county? San Francisco. What's the second highest? You're sitting in it, Orange County. We already have significant population density, and obviously we're going to need more, just given the limited space that we have to work with. We're still opening up. If you have questions, please raise your hands, because I'll just keep going all day until they cut me off. But I want to make sure we're covering the things that all of you want to hear. And we have a question on this side of the room.
I have to say, all of us at the table over here, except for maybe one of us, it was CEQA. That's the big one. It's a tough yoke. But that's not my question. My real question is this. The obstacles that have been raised seem virtually insurmountable given the current administration. I want to ask about how many jobs are already being lost to remote work. And John, this may be something you're monitoring. How many people in Orange County are already going, I can't work here, I'm going to work for a company elsewhere, or businesses that are going, I can't find the talent here, I'm going to find it somewhere else, given the rise in telecommuting. Thank you.
So I don't have those data off the top of my head, but my guess is someone at this table does. 15%, I just was magically told.
Yeah. And what we're seeing in a lot of the trends is the fact that because of remote work, you have much different competition among employers in terms of the workforce. So I'm on the board of a data management company, and we're based about an hour outside of Wichita, Kansas. We have a lot of employees that we're bringing on that live in other parts of the nation, which means to get the talent we want, we have to pay more. We no longer have that cost advantage of being in remote Kansas. But it works the other way too, where you have workforce that is in Orange County that can find opportunities. You don't have to live in Orange County. If it's 15%, right, that's a percentage of a workforce that we can bring on that doesn't necessarily live in Orange County. And I think we're clearly seeing a lot more of that. Any other questions in the room before I go on with one of mine? So, there we have one right over here. And please ask questions. We want to make sure we're covering the topics that are of interest of all of you, not just me. Go ahead.
Hi, thanks for all the information. It's been great. Quick question for the gentleman with the UC school district. I know other states offer forgiveness on loans to keep the talent there. Is there any discussion within the UC or the state groups that are talking about forgiving their student loans to keep the people in Orange County, to keep the people? Because we take in a lot of kids from other states, and then they just go home. We take people from other countries, and they go home.
Well, first of all, about only 20% of UCI is from out of state. So most of our students are from in-state. I'm going to turn to my colleagues at the UCI table. There is no talk right now of loan forgiveness, is there, for staying in the state? Yeah, I haven't heard of it either. So it's an interesting idea, but I don't know of anything on this yet.
Not aware of any. We have another question in the back of the room.
Good afternoon. I'd like to just thank you all for a great lunch and great statistics. I'm a proud member of the 65 and up crowd, so I feel 40 though, I feel 40. Not a question, but more of a commentary. We represent Orange County Realtors, and our mission is for housing affordability and homeowner availability of homes, et cetera. But I'd like to make sure that in the event of any type of work group, any plans that you go forward with, we certainly want to be at the table with you in any way that we can. We represent 15,000 members. We are the largest association in California. And here I have associates that are PAC trustees, our government affairs director. So we are well entrenched in not only Orange County, but outside of Orange County throughout the state. So again, please let us know how we can help or be part of the solution.
So we really appreciate the relationship that we have with our Orange County Realtors. We know you're also very focused on housing supply. And I would say an answer to your question is be engaged with us, particularly at the local level, where we really need to make the case for some of these city council members to be able to confidently support housing projects. We know there are elements of the population that would just as soon not see new housing come into their community, particularly housing that has higher density. And these council members need to feel as though they have the backing and support of the community, especially the business community, all of us that need places for our workforce to live. It's important that we're there to give them the confidence and support as they make some of those decisions that may not be popular with all of their constituents. So anybody else have anything they want to add in regards to that question? Okay. We have another question. Do you have any over here? What's wrong with you over here? Georgie's not doing his job? What's going on over there? All right, we'll get one over there. But first, let's go back here.
So for Veronica, the CalAIM program has been critical for our work as a nonprofit helping homeless families. We know that program is set to expire at the end of 25. Can you share of any efforts or conversations or progress to maybe extend that or renew it or rebrand it as something?
Sure, thank you for that. So our waiver that allows the CalAIM program is set through January 1st of 2027. So you have a couple more years. But I hear what you're saying, and that will be absolutely at the top of our advocacy list come January 2025 to ensure that any renewals we may need at the federal, state levels. I'll need to connect with you to make sure that we can have a conversation to advocate together for that.
Thank you for that question. We have one over here.
Yes, this may be a not very intelligent question, but forgive me. What I'm wondering is there seem to be so many different groups. You know, we're losing small children from what it sounds in the projection. Our young people are actually going out of state once they graduate. We're getting all these elderly. My question is almost strategically, how do you begin to focus efforts, whether you begin with, for example, the workforce housing that you're talking about, which makes sense because that might bring more children. But I'm just wondering how this is totally spread out and how strategically would be the smartest way to begin to solve all these issues. It just seems like it's a lot of them, and that complicates things.
Right. So Certainly meetings like this are a good start. And we have, as part of our focus on economic development, we center in on a number of initiatives around workforce and housing, infrastructure, which is something we haven't even talked about yet today, is another essential component related to that. But I think it's really being able to get people in a room to really understand and focus on the issues and provide that level of support that our electeds need to be able to make the right decisions. We have some tough issues that we have to face. We all care about the environment. That's part of our quality of life, is having a sound environment. But yet, when policies that are intended to protect the environment become a major obstacle for our ability to build housing and to do our infrastructure projects, it's a problem. And I would assert that it's one of the main reasons we have the situation that we're facing, where we continually tell our builders what to build, where to build, how to build, and we have added extraordinary regulatory costs to building a home, over $120,000 per door in the last 3 years in new regulatory costs. So you want to talk about affordable? For someone on minimum wage, $120,000 is the affordable mark, and that's just increased regulatory cost. And when you add labor costs and material costs and all that, it becomes extremely expensive. And what it also means is we have to find creative solutions. It means that we as a business community have to become more engaged in different options that we have for our housing supply. Any other thoughts in regards to that?
The future starts with our children, and so I want to call out the child care component piece of the report and highlight the work that First Five has done in order to support with the affordable, attainable, accessible childcare that's high quality. It's been many years since I paid for childcare costs. I don't know how I would do it. And this is coming from a homeowner, someone born and raised in Orange County. It is unachievable for so many. And so as a priority, childcare, supporting the visibility, and I know that OCBC is a component and a large partner in that work, but you can't have working parents if childcare is not secured, of quality, and that needs to be accessible, and you can't have a family paying 2/3 of their income towards childcare.
Any other thoughts, John?
So let's not have this be a downer. And I realize it's becoming that. Oh, the sky is falling, it all sucks. Let me remind you something you all know in your hearts. When we did our poll, we asked people, do they want to leave? Do they like living in Orange County? 80% of Orange County residents like living here. They appreciate the quality of life. They want to be here. Even people who left, and we polled some of them, they all like it here. They didn't want to leave, so people like it here. You can do multiple strategies at once. So it's possible to do various things at the same time. Number one, we need to prepare for an aging population. And I think the two of you have given us some priorities of things that need to be done and that organizations are doing to be ready as we have more of our population get older. Number two, if we are going to see people commuting longer to come into Orange County and service jobs, then we need to be thinking about alternatives for them to make that commute. That may be more bus service. It may be other kinds of novel approaches to making it possible for people to come back and forth. The third thing is, again, I'm going to go back to what I said earlier. We need to be more creative about housing options so that we're able to keep more people here. So there are a number of things that can be done, and frankly, thankfully, are being done right now. This isn't, oh my God, the house is on fire, we're all going to die. It's more, there are a number of challenges that are facing us, but this is a county that has the resources, the brain power, and frankly, the energy to be able to get some of this done.
Yes, and to continue with the good news, we have a very strong economic base in Orange County, right? It would be a much worse problem if we had a housing oversupply because everybody was leaving and we didn't have job opportunities that are here. So you're right, we do have to look at it as a glass half full and be creative in how we address some of these issues. I think we have a question over on this side of the room.
At the risk of being a downer again, I wanted to ask specifically about NIMBYism, and I have a couple anecdotes. I have a cousin who has a daughter who was telling me he aggressively opposed a homeless facility being built in his neighborhood. He said, hey, we need it, but I have a daughter and I don't want that in my neighborhood. And then secondly, there's a neighborhood in Santa Ana called Floral Park that I've attempted to open a business nearby. And that community is very tight-knit. And I just want to point out how the interests of a community can maybe be opposed to the broader interests of the city or the county. So just want to get your thoughts on how to reconcile those.
Yeah, I think naturally you have a lot of conflicting interests that come into play, and I think the discussion around a homeless shelter is different than the discussion around a mixed-use development, right? So we have to be able to differentiate. But at the end of the day, our elected leaders need to be able to vote with confidence that they can support the type of projects that are not only going to address the needs that we're talking about here from a business standpoint, but also that's going to benefit their community. We're really good as a state at using a stick, right? We have these RHNA requirements and things that we put on cities, but how about carrots? How about things that will make it easier for our cities to make this decision and to be able to build their communities so that businesses like yours can flourish? And I think that's a big principle that we need to continue to focus on. Any other thoughts on that question?
So NIMBY is real. We all know that to be true. But let me just share one thing with you that you can take back as not, it's a story as we say where I used to live. It also happens to be true. My school has a research group called the Livable Cities Lab. Some of you may have interacted with them at some point. And they went into Orange County and looked at what happens when affordable housing projects get built in the county. What happens to crime and what happens to housing values around those. Because the assumption, of course, is if you put affordable housing in my neighborhood, crime is going to go up and I'm going to see my housing prices go down. What they found is that when affordable housing projects went in, housing prices in the surrounding area went up. And they also found that crime rates stayed stable or went slightly down. So the idea that if you put affordable housing into an area, everything is going to go the wrong direction just doesn't match what the data show.
Yeah, I'm glad you pointed that out. I was hoping you would mention that report. All right, we have time for one more question, I'm told.
Don't be shy.
Anybody that has anything? Otherwise, we're happy to wrap. Sue Parks, finally coming in here.
Not really a question, but thank you all for this conversation. But just some things that all of us in the room could do and the companies you work with is that there is a program, and we work off of a cost study that we did with UCI, but it really takes the facts and helps people better understand the situation, and then you can become a housing champion. And we have an effort that you can get involved and be trained in terms of with real facts and real information to go to city council and planning sessions. So if everyone in this room said, I'm going to do that, I'm going to be part of it, we can all be part of the solution. So who's with me on that? Okay, all right. So there's a lot of information, and one of the things I think that gets me every day is our fastest growing population of homeless people are senior women, my people. So I just want everybody to put that vision in their minds in terms of what's going on, and to, if you want to learn some of the facts, the study that John just referenced, the cost study, you can go online to the Homelessness 101 class, but then be part of the solution. And that's an optimistic, because I know in Orange County we can do it together. So thank you.
Great. Thank you. So in wrapping up, I just want to make a couple of comments. First of all, again, the great trends that we're seeing from an economic standpoint. Orange County continues to be a great place to do business, and we have great opportunity here. We have to address some of the issues that we've discussed today, most notably what we have with our housing supply. But we're very proud as an organization to bring different groups together. The reason Orange County is so successful, the reason Orange County has such a high demand for housing is because we have great people. And that includes the nonprofits, and the work that many of our public agencies do. And we are extremely proud at OCBC to work with all of you as partners as we address these issues. So please stay engaged. The fact that you're here today is very telling. We look forward to having more updates in the years to come, and we really appreciate your attendance and your engagement here today. And I also want to thank OC Forum for providing us such a wonderful venue here today to be able to roll out next year's report. And you should all have on your chairs the ability to scan the link so that you can pull down the report, which is now made available to all of you. So thank you again for being here. And at this point, I will turn it back to my good friend John Christensen to close this out. Thank you, John.
All right, thank you, Jeff. Can we get a big welcome and a big thank you to Jeff and the panel?
Oh, okay.
What you may not know is, in addition to being on this panel, Dean Gould woke up this morning on the East Coast. And he is here today and obviously very engaged. So again, one more hand for the panel. And Dr. Wallace Walrod. On behalf of the Orange County Forum, I want to thank you all for being here today. I wrote this down because I didn't want to mess this up. Our last critical conversation will take place next month, December 12th. I know there's a lot of things that I hear are happening in the month of December, but mark December 12th on your calendar. It is going to be a conversation you're not going to want to miss. It's going to be a 2024 post-election insights with Richie Ross, Mike Madrid, and our very own Jenna Jensen as the moderator. And the reason you won't want to miss this is two things. One, it's going to be a great conversation, and two, everybody in attendance. Yes, there's going to be more. You're going to walk away with Mike Madrid's book, The Latino Century, How America's Largest Minority is Transforming Democracy. And we all know that played a little bit of a part in something that happened recently. OCForum.org is where you need to go if you would like to get tickets for that. On your way out, please thank the Hyatt folks for doing all that they did today. I want to thank the ComLab folks for all that they did. And I'm going to ask Georgie Sandoval to come up here. We got a special thank you here. Georgie, today is his last day with us. Yes, big. Georgie's put up with us 6 years?
4 years.
4 years, seems like 6. Yes, he's had to have me for the last 2. Trust me, there's been dog years for him. But Georgie has made sure that everything runs on time, and he crosses the T's, dots the I's, is just an absolutely wonderful person to work with. He's actually going to Jeff's organization. Jeff, of course, being smart to see talent, said, hey, come on over to our side of the world. And so if you would all please join me in giving Georgie a large thank you send-off, that would be great. Thank you. No. All right, have a great weekend, drive safe, and thank you all for being here. Take care.